I had a cavity. Yes, and nikang'olewa.
It's expensive. Many people think that it's very expensive, so awendangi for a dental checkup.
I brush my teeth in the morning. From there I'm okay. What more do I need to do about my dental? It's
Greetings all and welcome to another episode of State of Mind. My name is Dr. Charlenevinayak and I'm here to discuss how dental care boosts your self-esteem. We'd like to invite you to join us on social media to engage with this discussion. You can do so on Instagram on Switch TV KE and Switch TV Kenya on Facebook, Twitter, TikTok and YouTube. Before we interact with our guest, let us hear what people on the street know about dental care and how it can affect your self-esteem.
And I've never gone for a dental checkup. Never. Mostly like Kenyans, it's not a big thing to Kenyans. So as long as your teeth don't hurt and you're okay. I brush my teeth in the morning. From there I'm okay. What more do I need to do about my dental?
Ukipata mtu ako na meno za brown kisamo itakuwa ngumu kwake kucheka that haha, it's expensive. Many people think that it's very expensive, so awendangi for a dental checkup.
I had a cavity. Yes, and nikang'olewa.
So welcome back, and now that we know what people out in the street think about dental care and self-esteem, we'd like to welcome you back into studio. And before that, join us on social media on Instagram, Switch TV KE, and on Facebook, Twitter, TikTok, and YouTube on Switch TV Kenya. So welcome, Dr. Charlenevinayak.
Thank you for having me here.
It's exciting to have you here today. So tell us about yourself, tell us what you do about teeth,
Yes.
just generally.
So, firstly, thank you for having me here. It's a real pleasure to be here with you today. I'm a dentist by profession, but I've specialized in implant dentistry, so a specific aspect of dentistry that deals with the replacement of missing tooth structures.
Okay.
And I've been doing this for the past 5 years, but prior to that, I do have some experience as a general dentist, as well as working in the hospital setup during my internship days. I'm very passionate about what I do. Dentistry is in my family. It's what both my parents are, and growing up, it's the only thing I ever saw myself getting into.
Okay.
I'm not scared of the mouth or of the patient, or that fear went away a long time ago, and I'm loving it. Been in this profession for some time now, and looking forward to each day that comes.
Okay, good. So tell us, implants.
Yes.
So what do you replace with? Do you use teeth from cows? Do you make them in the lab? Because people are walking around without teeth and their self-esteem is struggling.
Sadly.
Yes.
So if you look at the picture behind us, you got the tooth that's emerging from the gum tissue. We refer to that as the crown of the tooth.
Okay.
But there's 2/3 of that, more than what you see, is still stuck in the bone below the surface.
Yes.
It's a bit like an iceberg where you just see the top, but the bulk of that is below the surface. When we talk about implants, we are replacing the part that is there in the jawbone. The implant is not visible to the oral cavity.
Yes.
But what the implant does is it gives a new foundation to support a crown on top. And the implant is made of titanium, which has been used in the medical field to replace knees,
Fractures,
hips.
yes.
Bone actually grows onto titanium. So when you put that in the jawbone, you give it some time to heal up, you now have a new root or a new foundation that can support a future tooth.
Okay, good. Thank you for opening our eyes to this new implant technology and why you should not walk around with teeth that are disturbing you because they're missing.
Yes.
If that can actually be fixed.
Yes.
So in regards to you, how important is dental care in regards to self-esteem of a patient?
I think extremely important and often overlooked aspect of what affects someone's self-esteem. Self-esteem is there's several different factors that affect someone's self-esteem, dental and oral health being one of them. I think the effects of dental health to self-esteem come from two aspects. You got the physical aspect where someone's got some sort of pathology with the teeth. It might lead to teeth that look bad, crowded, stained. You got missing teeth, and subconsciously you're aware about this imperfection that's in a very prominent part of the body, something that when you first meet someone, they pick up on straight away. And that may affect your outlook on how you perceive yourself, how you carry yourself. It can affect your confidence.
Yes.
But more than the physical appearance, if you're not feeling well in the mouth, you have a tooth infection, you have a cavity that's been nagging away at you, you know, subconsciously causing a bit of pain over there, that also affects how you conduct yourself and carry yourself, because you feel less than perfect. You know that there's something wrong, and that might give you the body language of someone who's not very positive or approachable, and that in turn translates to how other people approach you, and these things spiral down together. But I think there's a big effect of your oral health on the self-esteem.
Okay, good. So I think some of the major problems that people have that affect their self-esteem, you see, maybe crowding of teeth, it's not very visible, but what do you call it? The halitosis, the poor smell from the bad smell from the mouth, and these stained teeth.
Yes.
I know they really affect people. The people who will not speak in public because of how colored their teeth are.
Exactly.
And the others who cannot hold a conversation because they can see that everyone can smell what is coming from their mouth. So as a dentist, how do you solve stained teeth, and what can you also do about a bad breath from the mouth?
So to answer your question, with stained teeth, we need to first establish whether the stain is something stuck to the surface. Is it an extrinsic stain as a result of external factors, for example, caffeine, tobacco usage, or just lack of oral hygiene? Or is the stain embedded within the tooth itself? And that's very common in this part of the world, especially from the Rift Valley. We have a condition called fluorosis. Those who drink or rely on the water from underground, you rely on public sources of water. In this country, that leads to fluorosis of the teeth because it's very high in certain minerals, which get embedded into the tooth. That is an intrinsic stain that no matter how good your oral hygiene is, you cannot clean that off. So the treatment approach is different for these two types of stains. If it's something just external, we can try and clean it off or polish the tooth in a way that we can very gently remove that outer layer and get down to good clean enamel. But if it's ingrained within the tooth, for example, fluorosis or other medications like tetracycline, if while the mother is pregnant, if she is exposed to that medication, that can actually go through the placenta and affect the child from that very young age. So if it's within the tooth itself, now we're looking at masking agents. You're trying to just hide the stain itself. So these are cosmetic treatments, for example, veneers or composite masking on the tooth, something that can just hide the darkness through it. So the two different approaches we would take.
Okay. What about bad breath? What can you do? What causes bad breath? Because I know it's, as we said earlier, it's a big problem for some people. And what causes bad breath, and how can you solve it?
So bad breath, we want to first optimize the patient's oral hygiene, make sure they are brushing nicely, eliminate environmental factors that might be contributing to that. For example, dehydration. It's often overlooked and its effect is underappreciated on several aspects of your health. But when it comes to the mouth, when you're dehydrated, your mouth is dry, you have limited salivary production, and that sense of a dry mouth when your mucosa is dry just emits these odors a lot stronger. The simple act of drinking more water can reduce that. But we can also do a cleaning. We can recommend certain topical agents like mouthwashes, dental chewing gums, that their effect over a continued period can help reduce the bad breath.
Okay, thank you for that. So, most people don't know that drinking water would sort out bad breath. People are struggling with certain toothpastes, and I think that's why one needs professional help. When it comes to, if you're having a problem, just seek professional help. Don't go to Dr. Google, because it's not the same as meeting a dentist in flesh and blood. Good. So tell us, I know you're newly trained. Okay, not newly trained, but you're highly trained. So what is new in this dental field? Because I know we could get our teeth removed from a village, doing makeshift things. So what's new in the dental field currently?
I think it's probably the most exciting time ever in the dental industry. If I compare to, like I said, my parents are dentists, and I see the innovations that they experienced in their lifetime. what we have seen in the profession in the last 10 or 15 years is leaps and bounds ahead of anything that came in the past 50 years.
Yeah.
We now have the incorporation of different technologies like 3D printing within our dental offices. We got 3D radiography, access to three-dimensional digital CT scans of the mouth.
Yeah.
So you're not just looking at, cross-sectional films, but you can actually manipulate this 3D scan in the mouth. And when you're doing a surgery on the jaws, when you can actually visualize that before you go in there,
Yes.
just the fact that you know what to expect can take away half the source of errors.
Okay.
We got 3D scanners, powerful softwares that use artificial intelligence to redesign what the patient's tooth anatomy should be.
Okay.
So I can give you one example in terms of how this technology comes together. Patient comes in, they've just chipped a tooth and
Yes.
they had a fall, they've come in with a tooth that's half there. We can take a quick 3D scan of the mouth with the scanner. It takes about 2 minutes, painless, and let the software work its magic. It calculates what the replacement tooth should look like based on how your opposite arch meets the broken tooth, how your bite is, and creates a shape that would work in there in function, not just in terms of aesthetics. Now that shape is then sent to a 3D printer in the same office,
Yes.
and it's 3D printed over the next 7 or 8 minutes. You get a replacement tooth that can attach to the remaining piece over there
Wow.
in
Wow.
the same visit.
Yeah.
And this is all computerized, this is all technology. This was not there 10 years ago.
Before. Wow, wow. So thank you so much, Dr. Charlene. That is new technology. We're learning a lot. So do not walk around with broken teeth that are giving you stress. So we'd like to take a break and we can
Yeah.
continue with this exciting and insightful discussion. So we will see you after the break. Welcome back after the break. And so did you know? So now, Dr. Charlene, let's continue with the interesting discussion. So tell me regards to 3D printing. So it prints out a tooth that is good material that can go back into the mouth.
Yeah, so different applications. The dental 3D printers work with different resins. They're all resin based. Now you can get a resin that can print replacement teeth. For example, the crown, if that's chipped or needs replacing, you can print tooth colored materials. One very cool application of this is when doing dental implants, we can print surgical guides. So no matter how good your diagnosis is, you got a 3D x-ray, you plan on the computer where you want that implant to be in relation to the bone and the tooth.
Yeah.
Someone has got to drill that hole. And how do
Yes.
you translate the virtual plan of where the hole should be to the mouth? How do you take the human error out of there? We can 3D print a surgical stent that sits on the side teeth with that a guide or a channel for where our drill needs to go, perfectly planned by the computer, so that there's no error in the mouth. You're not drilling holes where they aren't supposed to be.
Yes.
So that's another cool application. Finally, people who grind their teeth without even realizing you're
Yes.
clenching your teeth, especially at night.
Bruxism.
Bruxism. One of the most effective ways to limit its damage, because you don't really want to go into antidepressants and antipsychotics if you can avoid it. Simply get a night guard or something that you wear on top of your teeth, similar to what these sports players use when they're playing,
Yes.
and that takes the damage instead of your teeth. That can be 3D printed, and again,
Okay.
its whole design is planned by the computer, and the list goes on, and there's constantly new applications coming out.
Okay.
So, yeah.
Technology has really changed how dentistry is
Definitely.
done. It has really changed. So tell us, now we coming from the general public, what are the misconceptions in regards to dental care, and how does the public perceive dentistry from your side?
I think one of the main misconceptions here, it is painful. Almost everyone you speak to
Yes.
who's overdue for their dental checkup and speak to them, why aren't you going? One of the responses is, I don't want the pain associated with the visit, or
Yeah.
I think it's going to be really painful when I go in and get that injection. Firstly, you don't need an injection for all treatments, so you can take that away.
Yes.
But even the other treatments that we do that do require that local anesthetic, the needles have gotten narrower, smaller gauges over the years. That takes a lot of that pain and sting out of the topical anesthesia.
Yeah.
Dentistry does not have to be painful. I think another misconception can be that it is expensive, and
It's not expensive.
it doesn't have to be expensive.
Wow.
There's a whole spectrum of treatments to address a specific problem, ranging from some that could be expensive to some that cost just a couple of hundred shillings. And it's about understanding what's possible for you and make an informed decision. And expensive is relative. You see where you fall into that spectrum there. Another thing I would say is with preventive maintenance and regular checkups, you can avoid the eventual failures that are expensive through smaller amounts over a period of time that just make sure that your mouth remains in a healthy state.
Okay, good. So now that you've mentioned regular checkups, how many times should I come to a dentist? Is it every month, twice a month? So regular checkups, because in the medical field, we have those executive checks that you can do once a year. So how is it for the dental clinic?
So I believe it's a very personalized approach. It varies from person to person. Some people are in need of high maintenance. They have a tendency to build up more plaque and calculus compared to other people. And I would say for them, maybe 3-month checkups and cleanings. For others who have a generally good baseline, no major problems to begin with, possibly even an annual checkup can get the job done. And generally those who start from a young age can get away with annual or even once every 2 years sometimes with just a checkup. So person to person.
So one needs to first of all see a dentist to be able to know how many times am I going to come.
You've got to establish a baseline,
Okay.
and we'll need a couple of consecutive visits to determine what sort of recall period would work best for you.
Okay. Now, for people who want to keep good oral health, for their own mental health, for their own self-esteem, I know having a good set of teeth is good when smiling for pictures. And you'll see people who are sitting at the back of the pictures, they don't want to take pictures, they can't smile, you're thinking the person is always in a fall mood. They just don't have good teeth. Now, what tips would you give for the general public? What tips would you give for them to take care of their dental health right at home?
So I think if you want to adopt a home approach to this, the important thing is to learn what is good home care. Good brushing techniques, use good products, use a toothpaste that's not damaging to your teeth. For example, there's this misconception that whitening toothpastes are good for everyone.
It's not good.
They are abrasive. The way a whitening toothpaste works is it's very rough particles that kind of abrade the outer layer of your teeth. Designed more for people like smokers who get heavy stains and you're just abrading away at the stains. But if everyone uses that, some people will end up with sensitivity over time because they've just worn out or thinned out their enamel on the tooth. So use good products that that support good oral health. That's what I would say. Learn good oral hygiene techniques, how to brush, how to floss, and use these regularly. Be vigilant. The second thing I would say is understand what a healthy mouth feels like and look out for signs and symptoms that require attention. So it's fine if you don't want to come in for regular checkups, but be aware of what's the status of your mouth. And if you notice that overnight your gums have developed a bit of bleeding when you brush, you get a little bit of sensitivity from a tooth that wasn't there, try and have those seen too. Don't let these problems accumulate.
Okay. So as human beings, can we eat bones with our teeth? Is it
bones.
harmful?
Maybe in a soup.
Okay.
I don't think you should be eating solids like bones.
Okay.
You could peel the meat off the bone, for example, with lamb chops or something, but to actually chew and break the bone, not with natural teeth, but you can do with implants.
Okay. Oh, okay. Implants can do that. Toothpicks, any harm in using toothpicks?
Yeah, so toothpicks, if used incorrectly, which most of us are guilty of, they can damage the gums between the teeth, that triangular gum tissue that forms between two adjacent teeth. Constant use of the toothpick can cause that to recede and shrink and create what's called a black triangle. When that gum recedes, you're now seeing the shadow of the mouth between the teeth. So I would refrain from toothpicks wherever possible. Alternatives to a toothpick include dental floss, which probably works out even cheaper than a toothpick. And there's more fancy options such as water flossing devices that require electronics and charging. Toothpick for me would be a last resort.
Okay. Now, mouthwashes.
Yes.
What do you think about mouthwashes? I know it's a very grey area. How do they work with our mouths?
So I think for the everyday person, a mouthwash is not essential. If someone's on a budget, I would rather you prioritize on a good toothbrush and toothpaste. Now, mouthwashes are a fantastic addition to your oral hygiene routine, and there's very little downside in using a mouthwash. Certain mouthwashes, particularly those that contain a certain amount of alcohol in them, they can burn the oral mucosa if left in the mouth for too long. And so you should limit its use or limit the time that it spends in the mouth. But it's beneficial. Some contain fluoride that can help strengthen the teeth. No harm in using a good mouthwash.
Okay. Good. Now, so Dr. Charlene, tell us, what are you doing in your clinic that other players are not doing?
We touched up a little bit on this. I think the emphasis on technology, or the ability to embrace the latest cutting edge techniques. We currently have 4 3D printers in our clinic. Most dental clinics in the West, in America or in Europe, they don't even have one at this stage in time. So we've got a lot here. We're kind of early adopters of this technology. So other than the emphasis on technology, there is the aspect of continuous education. I feel that's very important for all aspects of the team, not just the dentist, but our support staff as well, the nursing staff, to constantly improve themselves and learn new skills in their various trades. And so we make it a point to do a couple of overseas conferences a year. We attend the annual Kenya Dental Conference, and we send our nursing team for these various things. We actually have 4 of our nurses going to Dubai in the next 3 weeks to learn more about oral hygiene and how they can give instructions better to patients along those lines. So that's something I'm quite proud of about how we've set up our clinic.
Okay, good. So if someone would want to find you,
yes,
where do they get you? How do they contact you? We need to take care of our teeth to have good self-esteem. So how do we find you?
I think just go on Google. We've recently just created a new website that myself and my fiance worked on together. A good Google search. Our clinic is called Smile Africa. Smile Africa, and just type that in. You'll get our address. I would add on to that and say that for those who are not within our geographic area, just find a good dentist within your area. Don't give it that excuse that the dentist is too far or something. Don't make that the reason that you don't go see a dentist. But for those who want to find us, Smile Africa, you'll find us on Google. Okay,
thank you so much, Dr. Charlene, for educating us and also giving us empowerment on how to take care of our teeth to ensure that we're having good mental health. So for the viewers at home, we've enjoyed having you here. Please give us your feedback and send us your questions, and we'll see you soon.